Hello everyone. Today we will discuss about retinal detachment. This is a very serious vision-threatening condition. What is retina? Retina is the light-sensitive delicate layer at the back of the eye. This acts like the film in a camera. It captures the light and sends the signals to the brain so that we can see properly. Along with the cornea, the lens and the optic nerve, a healthy and attached retina is very important for good vision. When the retina gets separated from the underlying layers, it is called retinal detachment. Retinal detachment can happen in many ways. The most common is the Rhegmatogenous retinal detachment. In this, there is a hole or a tear in the retina through which the fluid from the eye gets into the subretinal space and separates the retina from the underlying layers. Another variety is the tractional retinal detachment, and in this, there is abnormal pulling forces from the membranes in the vitreous or the proliferative membranes on the retina. They pull the retina away from the underlying layers. The third variety is the exudative or the serous retinal detachment. In this, the fluid leaks from the choroidal vessels through the retinal pigment epithelium into the subretinal space, and there is no hole or tear formation in this. The Rhegmatogenous retinal detachment requires immediate attention to preserve the vision and prevent vision loss. So, what are the common risk factors for retinal detachment? The risk factors include the normal aging, changes in the eye, high myopia, previous eye surgery, trauma, and certain medical conditions which affect the retina. So, as I mentioned earlier, high myopia or severe nearsightedness can increase the risk of retinal detachment because the retina tends to be thin and more fragile in high myopia. Also, previous eye surgeries like cataract surgery can also increase the risk of retinal detachment because of the changes occurring in the vitreous gel of the eye. Sometimes injury or trauma can cause retinal tears and it can lead to retinal detachment. But in many cases, retinal detachment can happen without any direct injury. If you have a family history of retinal detachment or if you have inherited retinal conditions, then also you are at increased risk of retinal detachment. Some medical conditions like diabetes and hypertension, they can affect the retina, but it does not lead to retinal detachment directly. Diabetes can lead to diabetic retinopathy, and this can lead to tractional retinal detachment in advanced stages. Aging changes in the eye. As we age, the vitreous gel of the eye, it liquefies and shrinks and separates from the retina. And in this process, it is called a posterior vitreous detachment or a PVD. This is a very common and harmless process. And sometimes, rarely, it can cause a tear formation in the retina and then it can lead to retinal detachment. Are there any early warning signs of retinal detachment which we need to be aware of? Yes. Early warning signs include sudden appearance of floaters like spots or black lines in your vision or flashes of light. Sometimes there can be a curtain or a shadow covering a part of your vision, or there can be blurring of vision. If you have any of these early warning signs, then you have to consult your eye doctor immediately and get a dilated eye checkup done. So today we have covered some basic aspects of retinal detachment, like what is retinal detachment, what are the common risk factors, and what are the early warning signs, etc. So if you have any of the early warning signs or if you have risk factors for retinal detachment, please schedule an eye checkup and get a dilated eye checkup done as soon as possible. Retinal detachment is an emergency, but with early detection and prompt intervention and proper treatment, we can preserve the vision and prevent vision loss. Thank you.